What's up, guys? This is Dr. Kyle from Cape Chiropractic and Acupuncture coming at you with this week's movement tip of the week. This week we're going to talk about pec tension and how it can contribute to shoulder and neck discomfort. There are two major muscles that make up the pectoralis group, which lives in the front here. The first is the pectoralis major, which actually attaches or starts on the lateral portion of the arm, the upper arm, and kind of traverses across towards your sternum and your clavicle through this region. The second muscle is your pectoralis minor. And the pectoralis minor actually starts in what we call the coracoid process and runs to your second and fourth or third or fifth rib, whatever the anatomy or whatever your body read for an anatomy textbook. Long story short, these muscles oftentimes contribute to a lot of what we call internal rotation, or when your shoulder goes in this way, as well as anterior tilt and protraction. So pectoralis minor does the anterior tilt and protraction, and the pectoralis major, the bigger guy, does a lot of internal rotation. Now, how many people do we see from a day-to-day basis with this resting tone of kind of anterior tilt and internal rotation? In our clinic, it's very, very frequent with anyone who has shoulder pain, neck pain, anything like that. You may, if you work at a desk job, or if you see people sitting a lot of the time, and that's a very, very common resting posture for most people. So this stretch is crucial in helping kind of bring things back to or centrate the shoulder and the ball and socket joint in our glenohumeral region. So two parts to the stretch, and subtle details make a big difference. So we're going to start with the pectoralis minor, okay? So that's the one that's more angulated diagonally, okay? So for this one, a few things you want to keep in mind. Find a nice corner, first of all, or somewhere open in the room where you can do this stretch. You're not going to be able to see my upper arm, but I'm actually keeping my upper arm bent. If we straighten it out, it can put some tension on some nerves that we don't necessarily want. So keep your arm bent, okay? I'm going to start at about a 45-degree angle, or elevate my elbow slightly, okay? And what I'm going to do is walk forward until I feel a nice gentle stretch. Now I feel this right through here already, but there are a few subtle cues that actually make the stretch a lot better. Number one, you can slightly turn your body away from the wall here, okay? And that will intensify the stretch. But also, most people when they do this have the tendency to really, really lean forward. You don't necessarily have to do that. I actually want you to picture or think about trying to bring your arm actively backwards as you do this, because what that does is tell the brain to use the muscles on the backside as well as we're getting that stretch in the front. Last thing here, you want to think about keeping a nice upright posture in your thoracic spine, okay? So a lot of people may have that slouchy posture like this, leaning forward a little bit as they're stretching this out. Try and stay nice and upright, and almost try and extend through your upper thoracic spine a little bit. You should feel a nice stretch through the anterior portion of your shoulder and through the pec minor as you do this, okay? Hold it for approximately 20, 30, maybe a minute, 20, 30 seconds or a minute, until you feel a nice release of that tissue, okay? For the pectoralis major, there's a few things you can do. You can bring your arm down to about 90 degrees here, and again, slightly turn the body away, okay? And for this one, you can actually even go a little bit lower, and you may be able to straighten your arm out for this one. This actually starts to get into the biceps as well. Long story short, taking these tissues and opening them up provides a window for you to implement some strength and some extension into the shoulder, basically taking that ball and socket and moving it back to where it needs to be, okay? So try this stretch out, especially if you spend a lot of time sitting, or if you have a kind of a resting tone of being in this position, okay? And it will definitely help out with any sort of neck tension. It can help reduce shoulder pain, especially with weightlifters or people that are experiencing a lot of pain trying to elevate their arms or go overhead. So give it a shot and let us know what you think. Thanks, guys.